Hi everybody, I'll just take this time to update you on where I've been and what I've been doing lately. I don't know how many weeks ago, it's been a couple months ago, I did a limbic system training program, and that really changed the way that I've been thinking about things, the way that I've been responding to different stimuli, chemical sensitivities, sounds, lights, just obsessive compulsive thoughts. It's really helped a lot. Secondly is I introduced the magnetic pulsar, electric pulsar, and ozonator into my routine. Have not done the gut area yet, but have been doing other parts of my body as needed. And then I saw my Lyme doctor and I got my raw data results back, which I'm going to do my second part of my 23andMe video on, and those results gave me some really clear answers into what I need to be doing next. And I have 5 supplements that I'm going to be adding into my regime, like 1 a week about, just to make sure that everything goes okay with that. So that's the third thing. And then the fourth thing is I was traveling the last 2 weeks, and I went to Phoenix and then I went to Wisconsin. And so I flew 3 times during those times, obviously, and I was fighting an ear infection. Now it's been over 6 weeks, and not exactly sure what's going on. So what happened was I was flushing it with tea tree oil, peroxide, and water in both ears, and doing neti pots because like my ears get infected and then my sinuses get infected. You guys might have similar issues, or vice versa. And then I just forgot what I was saying. So flying made my ears way worse. Anyway, I was doing tinctures for just cold and flu tinctures that I have that have always helped with the ear infections, but this time they didn't. So I went and saw an acupuncturist twice, and that really did help take down the inflammation and everything. I went and did cryotherapy twice, and that really helped take down the inflammation and everything. I have a video that I'm editing on that. It's almost done. And then I went and saw a dentist because I was like, okay, well, I know that Lyme patients just routinely have issues with their teeth, and they are going to see and starting to see a surgeon who will go into where if you have your wisdom, I cannot think of that right now. If you have had your wisdom teeth taken out, it leaves pockets, cavities where Lyme loves to hide, and especially in a spot that is already weakened from having a surgery. Now, mine was 15 years ago. A lot of people had theirs many years ago, and or even finding like things that are still in there. Like there was a lady that had gauze that was stuck in her pocket. Anyway, so I went and saw a dentist, and she just found like a little thing like on my jawbone. So I'm going to a surgeon in the area here to see, I'm in the Bay Area, and to just see like what that is. And so that's going to be biopsied, and then I am, depending on what is all going on with that, maybe possibly going down to Phoenix to have the surgeon there who specializes in treating Lyme patients with these conditions. And so I don't know, it's kind of up in the air right now, but my health has really taken a downhill, real steep turn lately, just in the last week. And I think it was just a combination of me eating things that were not in my norm. I did have some alcohol one day, or 2 days. And then I also was just out of my sorts, you know, traveling and it's just, that's a lot on any body, and for my body, and anybody else with Lyme disease, that's just extra. So I don't know, but that's basically where I'm at today. I've pretty much been in bed all day just because every time I stand up, I just feel really weak. And I know that I think I'm going to be getting, even though I'm not supposed to be getting it yet, I think it's going to be that time of the month again for me. And so it just makes my POTS symptoms a lot worse, and it makes me really weak when I stand up and I have a cold or something else going on. I also got a cold sore, which is something that happens every time I get sick. So yeah, no surprise there. But yeah, that's basically everything that I wanted to tell you, I believe. So I hope that all of you are doing well, and I will have that other video up for you guys very shortly, and love you all.